Hi everyone, I want to talk about a common skin problem that some people call rosacea, some say rosacea. Well, whether you call it rosacea or rosacea, depending on where you are on the surface of the planet, let's talk. It is a very common skin or ocular disorder. It can develop to rhinophyma, which is a very large bulbous nose secondary to untreated rosacea. That is, if it is untreated, then you're likely going to have rhinophyma. It's very common among European descent of Northern Europe. It's common in women greater than 30 years, but more males will have rhinophyma. And can you guess the reason for that? It's likely that more males that are affected will not seek treatment. It's less frequent in children and adolescents. Even when it is present, it could be mistaken for acne vulgaris. What is pathogenesis of this skin lesion? There's no clear-cut pathogenesis here, but some factors were identified to play roles, and that would include immunity dysfunction involving increased levels of abnormal cathelicidin and kallikrein 5. Cathelicidin is stratum corneum tryptic enzyme, and it has vasoactive and inflammatory properties. Tryptic from trypsin. Other associated risk factors are genetics, like I've just alluded to that in my first statement, that is very common among European descent from Northern Europe. Microbes stimulate inflammation. For example, H. pylori has been implicated, Staph aureus, Chlamydia pneumoniae, or Staphylococcus epidermidis. Sun exposure could be a trigger as well, and as well as extreme temperature can be responsible. Also identify as risk factors as spicy foods and alcohol. The list goes on to include exertion as a possible risk factor, and sometimes when it is wrongly diagnosed to be acne vulgaris and topical steroids are prescribed, then that could be the risk factor that will trigger rosacea. Also common will be anger, rage, embarrassment, and to people taking nicotinic acid or other medications that serve as vasodilators or anything that disrupts the skin system. What are the possible clinical features? It is seen at the face, and that will present with redness, papules, pustules, flushing, and telangiectasia. Telangiectasia is when there's visible blood vessels. There's possibility of bumps and pimples, ocular irritation, and visual loss. The clinical features could also include burning, stinging, dry or raw face or scaly skin, raised plaques, thickened skin, facial swelling, and fibrous changes. What are the possible differential diagnoses? I've mentioned it about 2 times before now that in adolescents, rosacea could be misdiagnosed as acne vulgaris. So acne vulgaris is a differential diagnosis, and we need to be extra careful because when that misdiagnosis is made, topical steroids could be prescribed, and that would trigger rosacea the more. Steroid-induced aciniform eruption could be a differential diagnosis. Perioral dermatitis, Demodex folliculitis, dermatomyositis with periorbital erythema, cutaneous lupus erythematosus, seborrheic dermatitis, sunburn, or ruddy complexion if celtic origin. What are you going to treat this lesion with? Topically, you can administer azelaic acid 15% gel or brimonidine tartrate 0.33% gel or metronidazole gel or cream at 0.75%. We don't use steroids here. No steroid of any sort, topical or systemic, in treating rosacea. No steroid, please. Also, systemically, you can administer erythromycin 500 mg per oral twice daily for about 2 months. Isotretinoin should be cautiously administered, particularly for every woman of childbearing age, because there is very terrible teratogenicity as side effects. So we have to rule out pregnancy first before administering isotretinoin. Doxycycline 100 mg per oral once daily for 3 months is also welcome. The other interventions that you could embark upon could be laser, liquid nitrogen, or electrocautery. How do we prevent this? Well, I would say handle the risk factors so as to bring the flare under control. That is, watch out for the emotions. Okay, this could be funny, so because I don't want you to have rosacea, so I want you to suppress your anger, your fear, and your rage. Of course, that would be good for yourself and for the society at large. Avoid spicy foods. My friend from Norway, who always asks for spicy food, is not happy to hear that from me right now. Okay, he comes to my home anytime and asks me if I have spicy foods. Well, if rosacea is diagnosed in him or any member of his family, I will counsel him against that. Topical steroids should be avoided. I've said that earlier. And the use of astringents like calamine lotion should not be welcome. No hot drinks. Avoid heat, but not in wintertime when you need to heat up your home or your car or your office. Light exposure should be decreased. This is an irony because light exposure is going to help in treating psoriasis. So knowing the definitive diagnosis is very helpful. And with that, I come to the end of this presentation as far as rosacea is concerned. I have made other presentation on acne vulgaris and psoriasis. Kindly check my channel and subscribe so that you can get these presentations immediately they are published. Thank you. I appreciate it.